Love it. 3 minutes early.
I know. And I stopped at the bank and I got gas.
You're so good. We heard from Sylvia today.
I heard you. I deposited some of my due money into my bank account so that I could get gas to make it work.
Okay.
Hello, everyone.
Hey, how are you? Sorry, I didn't realize I didn't have my phone on mute, but I fixed it. So
That's okay. That's okay. Just saying hi. I know we're recording. Also, I have to remember in small chat, like we're recording, and I have to like keep that in my own head. I think we're waiting on Greg. Our idea is that this will be a bit of a brainstorming session, as well as some thoughts for, how we can support this work and what might be some interesting sort of ways the school can, lead in some rural health areas. I think there are people on here who are like, and who are you?
I know who you are, Vanya.
Oh, thank you, Lily.
Let me see. I also know Mary Fox. Hi, Mary.
I know Mary. Yeah.
I know Sarah
I think I'm new, so I haven't been yet. So I don't think you know me yet.
Okay. Well, I'm sure over the course of the time that we are talking, I hope to get to know a little bit about you, Nikki. I hope to get to know a little bit about you.
I will say I don't know whose brainchild this session was or is, but thank you.
Oh,
Absolutely. Thank you. Yeah.
it was a bit of Greg and I talking, and we've been working on trying to put something together. And at some point in time, we're like, let's just do it. The first step is to just try. I'm waiting for him to join. We do have like just because we only have an hour. There he is. There he is. I was just, talking to folks, Greg. I was just chatting.
Okay, well, we are accumulating a fair number of people.
We are.
We had over 100 people register.
Wow.
Registrations don't mean attendance, by the way.
Right.
We've really
Right.
learned that. When you go, we've learned it for research related events, it's about 25% of people who register will show up in person. And it's about the same in my perception for online as well, maybe a little bit higher.
Well, I am dropping in the chat. So we can't do, because we don't have a lot of time. And if we do get close to 100 people, like that would just take all of our time to do intros. So I am dropping, this is being recorded, so we will have the chat as part of our information. So I'm dropping in the chat. If you'd like to introduce yourself. And I know some people are on their phone, some people are in different places. But introduce yourself and let us know who you are. And if there's an area of rural health or rural research that you're working on, share that too. It just helps us to have a conversation. So I mentioned I would introduce myself because Nikki was like, who is this random woman who's talking to us? This came from Greg. This didn't come from you. So I'm Vanya Jones. I'm the Assistant Dean for Community Engaged Research here at the Bloomberg School. And one of the, when Greg and I talked about this particular sort of convening and what we want to do, was thinking about overall, one approach is thinking about our partnerships. And some of the work that I've been doing at the school is how do we intentionally, build partnerships? How do we lead to do work with people outside of this school? So I'm Vanya, and I'm going to turn it over to Greg to get us started.
Hi, everyone. Again, thanks for joining. Looks like we're up to 35 already. We discussed that our portfolio, although rather expansive and touches many parts of the globe, we're less well represented, I think is one way to put it, in the area of rural health. A few years ago, led by Ron Daniels and others with the idea of enhancing diverse perspectives within our school and university community, there was discussion about how would we best go about doing that. And certainly from my perspective, when you engage folks, particularly at a research university such as ours, identifying areas where there could be collaborative research or practice activities seems like particularly in important public health areas, that could be a way of engaging people from differing geographic areas, different experiences and expertise, and bringing them together and expanding that the viewpoints. And so we talked about ideas for a rural health institute, for starting some collaborative partnerships or workshops for targeted recruitments. So we talked about this about a year and a half ago, and we didn't follow through with it. So now we're circling back, and it seems this seems much more opportunistic and reactionary, probably, because the funding and political climate has certainly changed since we had these initial discussions. But I think what we want to do today is really to have a brainstorming session. At the school level, we really just want to provide a forum where we could all get on Zoom, hear what people are currently doing, what they would like to be doing, where they think there are particular opportunities for potential collaboration. And I do want to recognize that there's a lot of ways that there could be mutually beneficial bidirectional partnerships. We do it globally. We do it here in Baltimore, but we don't have that much. We tried to gather a list of people with easily identifiable capacity in rural health, and it's just not as simple. We looked at funded grants. We looked at higher impact publications. And there are some groups that work in substance use, in aging and comorbidities, in equity research and special populations. So there is some level. I think we have to certainly recognize the expansive and impressive efforts of the Center for Indigenous Health, and we certainly could learn from that from the activities of the center as well. But again, thanks for putting your introductions in the chat. I'm really eager to hear what develops from this, but I will turn it back to Vanya. Again, she's our Assistant Dean for Community Engaged Research, and she's thought a lot about the partnerships that we have developed, particularly here in Baltimore. And I think as framing for this discussion, I think it'd be helpful for Vanya to share a little bit about that experience.
So it is a handful, and when I say handful of slides, I have like 3 slides that I just want to share. Let's do this. All right, are you seeing my slides or are you seeing my notes page?
We got slides.
Slides. All right, good. So just want to throw out there, these are two examples. There's a lot of groups around the school who are doing partnerships at the Bloomberg School. But these are two that I think we've spent a lot of time in the practice office of uplifting and working with. The first is something that some of you may be familiar with, which is called the Baltimore Community Engagement Committee. This is a standing committee at the school. Every department has a representative. Major centers have a representative. We also have what I think is a really unique feature of this particular committee, three community partners who serve and partner with different groups across the school also serve on this committee. And this committee has yielded different ideas and activities. There's a website here, if you Google, even if you Google Baltimore Community Engagement Committee, Johns Hopkins Bloomberg School, the website will come up and you'll see some of the stuff that we're working on. One of which, and was early on, and I'm going to share the questions, Dr. Hanifa Salim did some focus groups and different groups of people working in Baltimore. This is really early in the development of the committee to think about what are some things that we might need to do and do better. And out of that, I can just yield, like, right now we're working with Baltimore City Public Schools on a guidance of, if you're going to work in city schools, how do you do that? I don't know if many of you know, the schools has their own IRB. There's a lot of people who don't get through that IRB, even though, they'll tell you we do more rigorous IRB, sort of review, but there are other issues. And so I wanted to highlight this one in that example. And then the other one is in international health. There's the development of approaches for building fair and resilient partnerships. There was a Nexus convening. There is some guidance that's coming out of that. And this is thinking about how are we optimal partners for people in mostly low and middle income countries, with a heavy focus on the universities in those countries. And I bring this one up because I think the other conversation that we can have is, how do we partner with those schools or those agencies that are in the communities where we are doing our work, because they are also there and have a great sort of foot into what it means to be partners. So I mentioned the work that Hanifa did. These were some of the guiding questions that she put out there, talking about working with partners. And if you see, partnership isn't specific to research, even though we can talk specifically about research or research efforts. This was really thinking broadly about what does it mean to be a good partner. And if we think about the things that make it hard to be a good partner, in any way, shape, or form, we discover that they're pretty universal. If you have a contract or a budget, what does that look like when it comes to being a partner? IRB approval, what does that look like when you have a partner that's not at the school, right? So some of the things are universal. In the work that she did, again, there's a report on this, and I can share the executive summary if anyone's interested. Sorry, did someone have a question? Oh, if you can mute yourself, mute yourself. Some of the challenges identified, which I think are universal, and we just wanted to share that in the work that Hanifa did, were time constraints, the sustainability, funding issues, building trust from our institution to another one, identifying partners that are both breadth and depth of people that you would want to work with, not just gatekeepers, competing workflows, staff turnover. I've already mentioned the IRB delays. And I have to say the IRB does its job well here as a member of the expedited panel. Poor internal coordination of research efforts in Baltimore. So there are lots of people working in Baltimore, and we think about the overtaxation of some communities, and accessibility and of dissemination of findings. I said I had a few slides. Those were my few slides. I'm going to stop share. Because I think what's most important in this discussion is, what do you think is important? And so we have some initial questions, but instead of jumping into those, Greg, I wonder if you think it's appropriate. Let's just open it up and see if there are thoughts or, opinions or suggestions that people just want to start with.
This is a very broad topic with many different perspectives, and we really want to leave this hour-long discussion with some ideas about what are people doing, where do we envision opportunities, both in terms of specific partners to content areas. And I think the discussion will flow. Lily, why don't you start us out?
Thank you. Good afternoon, Greg, Vanya, and everyone. So thank you so much. So I would say I have kind of been in hibernation. I've been very active. I'm working. I am the director of the DRPH HPM concentration and on a couple of research projects. But my passion is rural. And it started from 2003 to 2009, Hopkins under Dr. Laura Morlock. And actually, I had a meeting with her this morning because this session was coming up. And I'm like, maybe the time has come. And she said, yes. But at that time in 2009, when our project ended, there was no, or not no, but very limited funding for rural work. So when we do, and that time my career, I had just finished my doctorate here, was just taking off. And the advice, rightfully so, was you do want to venture into where there is funding to grow your research work and teaching work. So mind you, this was 2009. And I would just say the time has come. So Dr. Morlock this morning, when I met with her, I said, should I just say muted or should I just speak up? She said, Lily, the time has come. You were waiting for this. I know I work in clinical quality. I work in patient safety very recently. And I think I put it on the, I don't know if I pressed send, but 2008 to 18, sorry, 2018 to 2023, most of my hospitals were rural hospitals in Oklahoma and Texas, based on which the perinatal safety toolkit, which is on the ARC website, was created. Now, it was not publicized as rural work, but our work was rural and urban, and the toolkit is there. I think I put the link also in you can look at the chat later. But I think what I have to offer, and then I'll just zip it and we can speak offline. Vanya knows, right? I want to be that sugar in the milk for any proposal that can use my services and my passion. Besides, of course, helping drive one or two proposals myself, but even for some of the others, just because of the background from the Rural Hospital Project, where we had about 1,100 hospitals, all rural hospitals on which we worked from 2003 to 2009. Mind you, I was a postdoc fellow at that time, so I was not like very senior, not that I am now, but that I would like to offer that to anybody who's thinking of a proposal, because I think it's not just that the time has come, we all need to be thinking and writing proposals between now and the holidays like crazy. And we will need all the traction we can get from each other to really develop good proposals and submit them, because we are not the only ones in the market. There are others as well. So that's all I'll say. I can share more and more and more offline, but I just wanted to put this out there. And really, frankly, Dr. Laura Morlock would be a great resource. I'm meeting her tomorrow again for lunch. I will tell her I volunteered her because she was the PI on this last, it was some millions, I don't know how much exactly it was, project in 2003 to 2009. So I'll stop here, but I am excited. Thank you.
Thanks very much, Lily. It's great to have enthusiasm and expertise offered up to everyone so easily. It's really fascinating to see the list of people and the types of things that are being done in the chat. We are going to take notes and we will accumulate this, and we will have some sort of follow-up convening. We welcome thoughts on are these working groups within particular geographic or content areas and things like that. We can certainly discuss that. I want to open it up to others, like any other sort of big picture perspectives that that people have in how to encourage our community to work in this area, or to bring people
Greg.
together who are already interested. Sean, go ahead.
Yeah, so hi everybody, I'm Sean Allen. All of my work is related to rural communities. I'm originally from southeastern Kentucky. I grew up in a holler. They do exist. But my feedback is a lot of people who are really new to rural research, they come into rural communities with a very urban or suburban perspective, and they just burn bridges as soon as they walk in because they have no idea how small towns work. So maybe maybe we develop a funding mechanism where we leverage somebody who's already doing rural research and somebody who's brand new to it so that they can learn the ropes, so to speak. I think that would be a good idea. And also just seed funding. I mean, you can do a lot of work for not a lot of money in a lot of rural communities. The issue is a lot of the funders are just not interested in it. Or you're competing against urban proposals where I mean, and I've lived in Baltimore, so I say this affectionately, but there's so much data about Baltimore. I mean, you could write encyclopedias about Baltimore, but when you talk about rural southeastern Kentucky, Oklahoma, Wisconsin, there's not a lot written.
Great. It's important that that's said at the outset, and I think as Vanya appropriately framed, we navigate similar issues with some of our communities here in Baltimore, with many other communities in global settings. Some of those lessons, as Vanya rightly points out, the lessons learned can be applied, but that doesn't mean that you're fully adept at going into rural community. I could say rural because I'm from Oklahoma. In fact, Sean's study in Oklahoma takes place just a few miles from where my family actually still have a ranch there in Oklahoma. So if you can't say rural, then maybe we should have some additional discussions about what is the best way to do this. And I like the idea of partnering. That's the bet that, I do a lot of global work, and I think that is generally that's a great approach as well. Other thoughts?
Can I also chime in and say, I saw Alex come off mute, so Alex, you're next. Sean, thank you so much for the suggestions, including if we were to have seed funding, what would be a focus that you would like to see the seed funding highlight? And to Greg's point, I love this idea of partnerships. Alex, I didn't mean to say you had to go off mute if there was something you wanted to say.
No, not at all. That was, I fat fingered my iPad here. That was not intentional. My apologies.
Harry.
So similar to this idea of partnerships, if folks have partnerships with either researchers or community organizations in perhaps first start with US states that are considered more rural. Oftentimes we think about it as states that have two or fewer, or I guess one or fewer cities with 1 million or more in population. So a lot of states don't have that. If you have connections in those states, either with other researchers or community organizations, if you would just pop that into the chat so we understand how much of this work is being done more centrally here through Johns Hopkins with outreach versus in direct partnership with community or researchers in more rural locations. And I would also like to know how many people work rurally in the international setting. So those folks who are working rurally in the international setting, and thoughts about, or programs that have potential for translation within US rural settings.
With the caveat that how I define rural may differ from Carrie's and many other definitions. And, I work in rural Uganda. It's a very rural part of Uganda, but I work in the district center hub city, which in some ways classified by Ugandan national government as a peri-urban or semi-urban society. So I think there's a lot of different definitions. We want to be very inclusive and broad when we are discussing this today, but recognize that it's not so simple as in what I'm thinking in terms of what might represent rural may not actually be the same as others. Jeanette.
Thanks so much. Hi, I'm Jeanette Jeffrey. Some of you might know me in my current role as the career and life design coach for the MPH students here at Bloomberg. I got my MPH back in 2007, 2008, and Gregory Kirk was my instructor in EPI with Rosa Crum. So good to see you again. Before I took on this role, I served as the health educator on the Rural Healthcare Transformation Team down at University of Maryland Shore Regional Health. And in fact, the director now of that program is a Hopkins graduate. His name is Aaron. He goes by Zach Royston, and he got his MS in population health management from Bloomberg. So he would be a wonderful person to partner with. The program is centered in Chestertown, Maryland, and that's where I currently reside. We have 19,000 folks here, of which 48.6% are older adults, age 50 plus. So anyone who's looking at that intersection between older adults and rural, this is a great population to work with. I also, prior to that role, was a tenure track faculty member with University of Maryland Extension, and I helped to create their farm stress management program. And my research area there was in stress reduction for farmers. And so it was depression, stress, suicide among farmers and older adults. So University of Maryland, you can look up farm stress management. They have a whole department that they're working with. So another great one to collaborate with. And then right before I came back to Hopkins to serve our students, I was the executive director with a nonprofit called Home Ports, also located in Chestertown, Maryland, and serving rural older adults who are looking to age in place. And so, always, I can tell you, as a former executive director, any money that can help to infuse that nonprofit is always welcomed, and anyone who's looking to create any research connection there, I'm sure would be greatly appreciated. So
Great, great. Thanks for all those resources and expertise. Sarah.
Everyone. I don't know how useful this will be, but Kansas was one of 14 states to be selected for the Transforming Maternal Health Grant, which is a 10-year, there's a 3-year pre-implementation phase of assessing stakeholder needs and values in rural areas, rural hospital systems, and a 7-year implementation phase around a set of pillars that are aimed to improve patient care and care coordination and access to maternity care of all kinds. I don't know a whole lot about it yet. We're just getting started, and I'm personally involved, but it does look incredibly promising. I'd love to hear if other folks are on the call whose states were selected to participate in that. But it looks really promising. I'll have to report back to you in about 7 to 9 years to let you know for sure. But it looks replicable. It looks sustainable, and I'm pretty excited about it.
We certainly do a lot of work in maternal and child health here in many different communities. So yes, that sounds quite exciting. Anyone in response to Sarah's question, does anyone else work with similar programs that we'll be developing in other states?
Maine.
Okay. Other suggestions. I want to I like the idea of seed funding. We don't necessarily have funding to announce, but we certainly can advocate for support for that. And I liked Svea's suggestion about, she loved the idea of seed funding for new partnerships, ones that Hopkins doesn't already have. And I think there certainly are you want to build from positions of strength and longer term collaboration, yet you also want to spur new collaborations and development. So I think there is this balance. You can't fund everything everywhere. At some point, you need to be relatively focused and targeted. I like the idea of new partnerships, I like the idea of having people work together with people they haven't worked with before. That seems like a very valuable entree to working in this space. Yet at the same point, if people have been doing, I think I would tend to favor if you've already have an established collaboration, then you can go ahead and roll with it. But if we had some pilot funding it seems to spur new collaborations would be pretty appropriate. I like that. I just wanted to see if others greatly agreed with that or if there were some reservations. Any viewpoints? No strong seed money or pilot funding, I must say, I'm not sure where we would look for funding. We would look for both federal funding as well as we anticipate that with some of the new administrative directions, there will be funding opportunities. I think that there would be more, like we're in the process of defining some of the school and university development goals for the upcoming campaign, and I think that we hope that to think about how this might fit into that. I think there's philanthropic and foundation supports. I think there's a lot of different opportunities. I must say I'm not that familiar with them. This is just beginning to percolate on my radar screen. Nikki, you have your hand up. Jeanette, you have your hand up, but I think that's from before, right? Nikki, go ahead.
Okay, sorry. I'm actually new. I started the MPH program this semester, but I have been working in the trench of rural healthcare for about 10 years. I opened my first independent pharmacy. I don't think there's any definition of rural health that is more suitable than where I live. I live in a population of 400. We are 30 miles from the nearest hospital. And I think my area certainly mimics a lot of rural areas across the country. We've lost 2 hospitals, small hospitals, and we just have to travel a really long way to get to a hospital. So now I have a rural health clinic. My family owns the only grocery store in our county. So we are trying to, make food access sustainable. So there's a lot of different areas. And between both of my pharmacies, I deliver to about 15,000 patients over 14 counties. So I have a lot of patient population as far as, research and that I have between the clinic and the pharmacies, a lot of patients that are, we could use for research. So I would be more than interested in will help in any way I can, because I mean, it's a struggle every day to survive.
Where are you, Nikki, specifically?
I live in Preston, Georgia, which is 8 miles.
Georgia. Okay.
Yeah, so 8 miles west of Plains, where Jimmy Carter lives. So pretty much
Sure.
everybody's heard of Plains, but yeah, we have a lot of agriculture, not a lot of industry, not a lot of jobs. So it's a picture of every rural community in this country.
And a very fascinating and unfortunate issue brought up that even in the heart belt where lots of agriculture is ongoing, there may be food scarcity and
Yes.
lack of access to appropriate high quality foods, and so that's a very interesting.
Yes.
Okay, well, thank you very much, Nikki, for sharing that. Other questions, comments, thoughts?
I do want to throw out there, if you're continuing to add things to the chat, we will make sure what we're going to do with this information is compile who's here, what areas that you're working in, if there are specific topics, so we can put together a list of what we found out here. We also, from our conversation, since it's being recorded, can write up what were some ideas, right? What did you float in this conversation? What are the challenges? I've heard a lot of challenges that we need to be really mindful of in working with rural communications or in areas where there's a lot of land and fewer people, when there's less data and less information. And if there was anything else that you think we need to sort of make sure that we add, this is how we think about, to Greg's point, thinking about development and thinking about pilot funding and thinking about all those things. Like, this is how we get to a dedicated committee for thinking about partnerships in Baltimore, was because faculty and students and folks who are here were really interested in what does it mean to build that strategy. So I wanted to throw it out there. So if you haven't dropped stuff in the chat or said something, please help us out.
Lily, go ahead.
I already spoke, so why don't we let Heather speak and then I'll.
Yes, thank
Heather,
you.
please.
Go right
Oh,
ahead, Heather.
I live in Metro Atlanta, but my son went to school in a very small college in South Georgia, which is not too far from Plains, Georgia. And one of the things the school, it's called Andrew College. There was 300 students at the college, and there was a small hospital that was next to the school, and it had to close down. So the community lost again the healthcare. And one of the things that's just kind of been running through my mind is that if we could get kids going back to that school to do public health, doctors, and get them back into the health system, back into the communities, then we would have them back treating rural health instead of in the big cities and then going back out into the bigger areas. If we could just get these kids right back into their communities, then we are kind of supporting their community system. So Andrew College did support they have a nursing program and a respiratory therapist program, but they lost their other programming just because of funding and stuff like that. So maybe if we think about other programming that starts with public health in smaller communities that could build on something like that, that's kind of something that I've been thinking about.
Yes, the struggle to appropriately staff the medical centers, hospitals, clinics in rural settings, it's difficult. You know, when I went to med school, and that's been a few years in Oklahoma, I will add. You know, they were talking about health professions shortage areas back then, and I'm not sure that there's been any progress, and probably in many cases it's not gotten any better. So you know, the supply of physicians, the supply of other mid-level providers, of other resources, like it's very difficult. The financial abilities of small rural hospitals to stay open and appropriately be staffed, many different things that would be highly relevant.
The only thing
It,
I can think of is Arthur Blank. You know, he throws his name up from Home Depot on the hospitals around here like crazy. You know, like maybe he could throw his name up on these rural hospitals, you know? Like that's the only thing that I can think of. So that's kind of just been going through my mind, something like I'm thinking about really getting through
You
this
know, I
degree
don't
and
I
starting to
don't know the
push.
answer to this. The trend in hospitals is for them to be swallowed up by very large entities,
Yes.
either large academic medicine. You know, Pennsylvania's a good example. They've been divvying up Pennsylvania between these big academic centers. So you got Pittsburgh and Penn State in the middle of the state, but there's also the purchase by for-profit companies as well. The staffing is also largely done by, in many cases, venture capital firms are first they go in and they take over the emergency room, then they supply the contract to provide the hospitalists, and then they start to go through the more specialty care. And you have different venture capital firms that do these. And you know, there's mixed results in what would be considered quality outcomes after that. So lots of health policy, health services, research related issues we've identified. Um, I'm not, you know, I think about the residency and medical school fellowships here. You know, we don't have a family medicine residency program. There's not a, we have an urban health track for many of our residencies and fellowships, but very few opportunities for rotations in even in rural parts of Maryland. Um, Interesting. Other thoughts?
So Greg, may I go now?
Of course. Go ahead, Lily.
Thank you.
No, you already you used up your one term. Go ahead.
So So we were talking about hospitals, right? So I put in the chat so I don't take too much talk time, but there are different kinds of rural hospitals, both size-wise and funding-wise. We have critical access hospitals. We still have about 1,300 of those. We have sole community providers, Medicare dependent hospital, and all. So the 2003 to 2009 study was actually a second study done at Hopkins. There had already been one done from 1988 to I think 95 before my time here. Laura Morlock was the common link. And I almost feel that now is the time to do another, not exactly the same, but a viability study, maybe with a smaller sample. I mean, we had the fortune of being able to be funded so we could have almost 1,100 hospitals, rural hospitals in our sample. I almost feel from the healthcare policy and delivery perspective to look at the clinical outcomes, financial viability. We had 3 arms as part of our study. I almost feel now is a good time to really look at that because the outcomes have only gone down in the past 15 years that we were waiting for rural to again become a priority. So I just feel and each state, as we all discussed, differs and varies. Texas is vast, right? Even size-wise. So then, and also the state level, not just the federal level, state level has a lot of say okay, we'll have these many critical access hospitals, which are pretty much 25 or less bed hospitals to serve a certain community. Okay, so I just want to put it out there that the other aspect which Greg, you touched upon is even at Hopkins, we do not have family medicine as a residency, right? We don't train them. We train directly internal medicine or other specialties. And I'm not saying we start that, but there are 3 arms we should be thinking of: practice, research, and even academics. Today, after COVID, our whole DRPH program is pretty much online. If the student doesn't want to or cannot, they don't even have to come on campus till maybe graduation. So I think that's another piece where we can look at hospital leaders or hospital managements that we offer them certificates, which are certificate in rural hospital leadership and management or whatever. I mean, I think I'm going too deep. I don't want to
Yes,
get
I think so,
granular
Lily.
today.
Let's
Yeah.
keep it a little bit higher level. I also want to, Emily, you had your hand up.
Yeah, thanks, Greg and everyone. I'm Emily Harris. I work at the Center for Indigenous Health, and we work a lot in rural areas, and I've lived in some of those areas as well. A couple of things, Greg, that have come up though. I thought there was at least through the mental health, or sorry, the ICTR, what's it called? The Maryland Clinical Research Network. I thought there were at least one hospital that's rural, maybe 2. Is that
Salisbury, I think.
yeah,
Salisbury.
exactly. Yeah. So I just wanted to raise that as a possible resource because there's already a network like built out for that. And I know in the past when I've talked to them about suicide prevention, they were very interested in collaborating on work out there.
The ICTR also offered grants historically with the Allegheny Health Research Network in
Yep.
Pennsylvania largely. So, and many of those, it wasn't exclusively rural. They transcended regions, but they also had pilot funds of about $100,000 for collaborative research there. I think they offered them for a long time, and I'm not sure they're still available.
Yeah.
It's also an ICTR existing collaboration.
Yeah, and then I think with something that's come up over the years for us has been I think about our students and also residents, honestly, with IHS, like the cost of those types of, we don't have any agreements with IHS. Many universities do. Um, we also have, there's a lot of tribal health organizations that have reached out for me for master's students, and we never, yeah, I don't think we do a lot to like prepare them course-wise to that type of work. And then, but like there are these practicum opportunities or opportunities when we haven't built out those relationships super well, but I think there would be opportunities to do that would, help us sort of reach more people in those areas?
So two questions from
Yeah.
both directions.
Yeah.
I think you're right that you probably don't get a lot of rural health focused content in most of our academic curriculum. I think that's an easy statement to make. But I also don't know what we do. While there might not be that many courses with rural health in the title, I wonder how many have illustrative sections or topics that might be relevant. We could try to do a little bit of digging to see if there is that. But again, you also have to ask, are we that attractive to some of our rural health students? And I think that's sort of what you're alluding to, but any more specific, is it about we don't necessarily offer the existing research opportunities that they might be looking for, that they'd have to do more legwork on their own to develop those partnerships? And is it also a funding issue or all the above?
I guess when I think about that, I think about something like a model like UW, which does a lot of, they have like a decentralized, they're located in Seattle, right? But they do sort of prioritize a rural health training program. I mean, a little bit for that.
They also have the existing medical school referral system for many of those states.
Yeah, yeah. But I just think maybe it's like both, right? Like I think we could position ourselves as doing more of this intentionally by really creating, a concentration, a subsection around this, but right now we don't, and so people don't really see us as that, directly, I guess.
Great, very interesting. Other comments or suggestions? Do any of you teach rural health issues in courses here at our school?
So, Greg, not teach rural health issues, but we've had some CEOs of rural hospitals who are either alum now or still students of our doctoral program, because it's online. That's the DRPH program. And I'm specifically mentioning about the health policy and management concentration. Now, how they get funded, I think about 1/3 are self-funded, but the remaining 2/3 are actually getting funding from their rural hospital boards, the board of governors or board of trustees. They want to grow these people, especially those who will stay on in their hospitals and not move on. So that's kind of my only connection as far as mentoring students from rural hospitals go.
Thanks. I think it's worth asking the important question of what do we actually bring that when you certainly think about many of the academic centers, and in many cases, in Oklahoma, again, where I went to medical school, the second largest employer in the state is the medical, center in Oklahoma City. It's clearly a urban setting, but you have a school of public health and pharmacy, and they do all this stuff already. They have existing rural health partnerships, and although I think we could certainly develop some collaborations on specific topics, I think we need to be cognizant of what is it that we bring to the table that is unique or important enough to have them bother with collaborating with us. To be honest, why do they need us? And I just throw that out as a provocative statement, and I'd like to hear what others think about that.
I'm also going to throw out there, if you work with a university or academic center, we've heard some folks talk about extension services. Thank you for bringing up the extension services. I think those are fantastic. Do you have partners in some of those communities? So I think expanding a little bit of Greg's question to, the academic institutions that are in these communities that we're talking about, because they have them.
And Greg, to your question and kind of part of this capacity building and pipeline building, What do we have to offer? So we have courses, right, that we teach internally in different certificate programs and stuff. I also have a Coursera online certificate, and actually it's highly utilized by folks in different areas of more rurality, not only in the US, but internationally. And it get, with this Coursera specialization, you get a certificate at the end, and it is Johns Hopkins branded. Because all 5 instructors are from Johns Hopkins. And these are the basic building blocks, right? Age standardization, direct and indirect, how we build public health infrastructure, that kind of thing, basics on outbreaks, basics on surveillance. So I do think there are pieces of tools and some more fully developed tools for training that exist that need some perhaps tweaking to be more representative and be more connecting to a rural environment and those folks who are working in a rural environment. The thing that we have learned is, as long as it is skill building, right? It's not more time on skills, right? That's the goal. The courses then do very well in terms of just interest.
Great. And I don't want to dismiss the capacity that we do bring to many different settings. I think that it's very substantive, but I think you should be cognitive that that we don't have exclusivity to many of those capacities. I would Keisha.
Hi, Greg, and my apologies, I'm not able to join by camera today. So I think that this discussion is incredibly robust, and perhaps with you pushing the envelope and asking what do we bring, perhaps we think larger than just Johns Hopkins and the Johns Hopkins community, and we think about having a more inclusive mindset. So as we all know, as COVID taught us very, very transparently, public health is done in collaboration and with consortiums. So maybe we think about having some sort of consortium of rural health organizations that can be from across the country that can partner with us, maybe some regional networks. So I work as a research scientist at MedStar Health, and I know MedStar Health is also thinking about having some sort of rural, either think tank or learning lab or institute, or that's also something that's been ruminating here at MedStar. But also just thinking about all of these other organizations, perhaps there's some sort of rural health consortium across the Midwest and across the Mideast and across the mid US, and it's helmed at Johns Hopkins. And so it's led by Johns Hopkins in collaboration with partners. And that way we're not reinventing the wheel, but to Emily's point, we're being inclusive of those folks and just building on. So Carrie mentioned having courses, but then again, we're not inventing those courses. We're essentially collaborating, and there's opportunities to partner and collaborate and essentially just become the bedrock for rural health innovation by being open to collaboration with other rural health organizations or other entities across the country that's interested in doing this. And I'll just give you an analogous project. For example, the World Health Organization has many different initiatives. One of them is patient safety action areas. I know Lily's done a lot of work with this. So when they wanted to, for example, have focus on specific areas of patient safety in specific countries, and under the African Partnership for Patient Safety Collaboration, they had a discussion with Johns Hopkins University. And so essentially it was helmed at Johns Hopkins University, but it was in partnership with the WHO and the African Partnership for Patient Safety, which was then in partnership with these other countries. And so it was all about bidirectional learning. And I don't know which political entity said it together, whose slogan it was, but essentially we're stronger together, right? So thinking about perhaps moving beyond just a rural health institute at Johns Hopkins and thinking more broadly across the country and just being more inclusive and inviting and just thinking about, again, having a broader angle to this. And I think this would be something that's unique because there are lots of entities across the East Coast. So Maine, Vermont, all of these places are doing great rural health work, and everyone's doing it in silos. And because we're leaders in the public health space, we can think about how can we take all of this combine it and move forward together. So food for thought for the group.
Thanks very much, Keisha. I think I very much agree. We should be thinking broadly and collaboratively. I don't think I actually know exactly what exists. From a very brief, I mean, most states have a rural health association. They pretty much have an office for rural health in many states. There's 9 or 10 rural health research centers. I think there's associations within public health, within the academic Association of Academic Medical Centers. There's NIH-funded groups that support certain regions as well as certain states that have different levels of funding levels. I think there's a lot of existing consortia and groups out there. I don't think I know I don't think I'm well versed enough to know whose door we should knock on to go down the path that you suggested, Keisha. So I think we need to do some more legwork to figure out what is being done, what is out there. We certainly, I'm not even sure it would be, again, thinking more broadly, we would certainly be supportive of those. I'm not sure we would be the lead organization. We certainly could help with convening. You know, Penn 55 building, a rural health symposium convening. I think all of those could be bundled together. I think in the last few minutes, I'd also like to take what are the proximate next steps? So we need to do some more legwork. We'll coordinate and collate all of these different ideas that people have. What would be the next convening that you would be interested in spending some time and joining in? Would you like to have a group that meets to talk about, support for the economics and staffing of rural hospitals versus maternal and child health issues, versus would you have broader discussions about forming a rural health association? I think there's lots of great ideas. We are more than willing at the school level to provide some administrative support, develop some meetings. We'll buy some food and lunch for people who want to meet in person. We are happy to knock on doors of others from around the school, university, and the broader, broader country to bring people together. But we'd really welcome your suggestions on what that bringing together in the next proximate steps would look like. Any last minute thoughts in the last 5 minutes about what would be the next steps you would really value? Working groups based on topic, based on geography. Megan.
Gregory, I think that was my line of thought too. I think in the chat we see some natural groupings. Lots of people focused on maternal and child health. I see quite a bit of digital health, and then maybe a domestic versus international subgroup. I think all of us are eager to collaborate out with new partners, with new colleagues in the school. So maybe that would be a natural next step.
So we can certainly have some bringing again some internal groups. Sometimes it's so I think working group sounds good. I think what we would also advocate is let's start to identify some of these working groups. In my experience, it's nice to have some visibility from a working group by inviting an external speaker or having the working group host a potential partner from certain university on the topic of relevance to that working group. That's a good way to bring them into the fold, to advertise amongst our own internal community about some activities and interests that might be good. We'd be happy to help coordinate that. So why don't we leave the chat open for the next few minutes so everyone can put in their suggestions of what would be working groups, and we can certainly follow up on what would be the most readily identifiable groups to identify. Vanya, digital health. That's a great one. Of course, that could be applied to many different content areas as well.
I appreciate. I want to start by saying I appreciate your time. I think Lily has left, but her enthusiasm for what it means to be in this space, I just really appreciate that everyone brought some of that. I want to also highlight that in the suggestions that you've given, I think there are some real discussion points that we can talk with development. I think you have given us some ideas around education, around practice, around partnerships, around collaboration. We can, and especially if you're here, we can definitely make sure you get the notes from this. I am going to volunteer both me and Greg. So, feel free to email me. Easiest email in the world, vjones, but you can find me. Or Greg, if you have additional ideas or thoughts or comments when you leave that you just didn't want to drop in the chat or share here. This is, if I can speak for you, Greg, I will. But this is an initiative that, the school is really interested in. I will also say, I know the university is looking at how do they support this type of work. What are some initiatives that can happen at the university level? And so we can, if we think about the ideas we have here, I think in a lot of ways when it comes to collaboration, our school is sort of the trailblazers at the university. And here's another way that I think we can, trailblaze and help move partnerships along. Any questions for us? Any thoughts or questions or additional comments? I'm really, like I said, I can't say enough about how thankful I am for you coming, fully and being supportive of, us trying.
Let me echo Vanya's thanks. I saw one chat that talked about funding and where it will be heading in future years, and I must admit, no one has the crystal ball. I think even the people who think they're in charge don't really know what's happening to funding. It's a continually evolving issue, but I think it's pretty clear that there is a greater domestic focus than there has been previously. And for whether that means a substantive increase in funding availability is unclear, but I certainly would envision that this is a growing area of potential funding. And that, again, that's not the only reason we're doing this, but it certainly is something that we are cognizant of and we would pursue. I think there was a fair number of suggestions about translating from a global to a domestic rural health setting, both of people who do it, have done it, and people who are interested in doing it. That seems like a really good topic for a seminar. I think I would welcome some suggestions on who would you actually invite, both internal and external speakers. I think that one just seems ready-made for an inaugural rural health seminar series. That seems like a good one. So please also send us any suggestions for speakers and topics of seminars. And with that, we have reached time. Again, thanks to Vanya, thanks to Junie, and to Sarah who help coordinate this, and thanks to all of you for the work that you do and for your interest in participating in this initiative. Have a great afternoon.